Welcome to the SCPS School Staff Medication and Health Training. This course is designed to educate SCPS school staff on medication policies and procedures. It will also cover some important student health topics to help school staff feel more prepared for a potential health-related emergency in the classroom or on school campus. Like previous Safe Schools courses, completing this training will be required every school year. We will review 3 skills competencies during this training. After completing the course, you will have access to links to 3 digital versions of these competencies for you to initial and electronically sign that you have reviewed and understand the competency steps. You will also need to complete the evaluation at the end to receive course credit and PD points. The course objectives are to educate Seminole County Public Schools personnel on district medication policies and procedures, to provide school staff members with a basic understanding of the procedures required to safely provide medications to students, to educate on 4 common medical emergencies and their related emergency protocols and medications, to discuss field trip protocols for students' health needs, and to review accessing student health information in Skyward. Let's start by talking about the importance of slowing and stopping the spread of diseases and protecting vulnerable students and staff to help ensure students have safe and healthy learning environments. Here are some disgusting but interesting did you knows about bacteria, germs, and viruses. Another one is your cell phone. It can be 18 times dirtier than a public toilet seat. So, what can we all do to help slow down or stop the spread of these things? Number 1 is hand washing. Hand hygiene is recognized globally as the most effective measure a person can take to prevent the spread of disease. Here you can view how the CDC recommends how to properly wash. And remember, hand washing is always best practice, but if soap and water are not available, you can use an alcohol-based hand sanitizer, but be sure it contains at least 60% alcohol. So what else can we do? In addition to proper, regular hand washing, some good habits that you can implement could include disinfecting your cell phones, keyboards, desktop, desk phones, and other items you touch frequently at the end of each workday, in addition to the custodial cleaning. You can create habits and reminders to avoid touching your face and to cover coughs and sneezes to prevent the spread of germs. And lastly, you can communicate with appropriate school personnel when someone or you are ill or showing possible signs and symptoms of illness. Now that we've covered some hygiene, let's move on to some required content: medication administration basics, policies, and procedures. Statute 1006.062 states that the school principal designates who will give medication. Administering medications is a procedure that a registered nurse delegates to you, the unlicensed authorized personnel, or UAP, under the Nurse Practice Act. Remember that there is no liability if you act as a reasonably, ordinarily prudent person would have under the same or similar circumstances. All medication administrations require orders from a licensed healthcare provider and parent permission on an SCPS medication authorization form, with some exceptions for over-the-counter medications and secondary school situations. Students may be authorized to carry and self-administer prescribed emergency medications including inhalers, epinephrine autoinjectors, pancreatic enzymes, insulin, and other diabetic supplies in all levels of school with the proper authorization from a healthcare provider and permission from parent or guardian. High school students may carry and self-administer prescription medications with proper authorization from their healthcare provider and permission from their parent or guardian. If students are authorized to carry and self-administer any medication, a copy of the authorization form should be kept with the medication on the student at all times. The next three slides are the three medication authorizations you would see either with the student or in the clinic. Unless the medication is checked in and stored in your classroom, clinic personnel will be checking for completeness and accuracy on these forms. Form 157 is used for most medications. The boxed area must be completed by the provider, and it must be signed by both provider and parent or legal guardian. Form 1552 is specific to allergy medications. All sections should be completed, and the boxed area must be completed by the provider. It must be signed by both provider and parent or legal guardian. Be sure to locate the area where it specifies authorization for the student to carry and/or self-administer the medications. Form 160 is the authorization used to allow middle school and high school students to carry and self-administer over-the-counter medications. It also allows elementary school students to carry and self-administer only the approved items listed. This form is completed by the parent or legal guardian. If and when you are expected to administer a medication to a student, you must follow the medication authorization order. You will need to compare the order or authorization form to the label on the actual medication. Medications can be given 1 hour before and 1 hour after the scheduled time. And always remember these 5 rights. Be smart. Write student, write medication, write amount or dose, write route like oral, injected, or inhaled, and write time to be given. A likely time that you may be responsible for administering a medication would be on a field trip. It is policy that during a field trip, students must receive their medication just as they would at school. A parent may administer medication to his or her own child if they attend the field trip. However, the school cannot require that the parent or guardian attend, regardless of the student's condition or medication required. This is the law. The parent may choose to withdraw permission to give the medication on the field trip, preferably in writing, but the school should never contact the parent to ask them to do so. If you are unable to attend or a substitute goes on the trip for you, the student and medication must be assigned with a trained teacher, never an untrained substitute. Before each and every field trip, we need you to share the student and chaperone lists with the clinic assistant as soon as you know. The clinic needs at least a week to prepare. Clinic will review the list for meds and health needs, and the nurse will train and review student-specific health and medications when appropriate. We can't emphasize enough the importance of notifying the clinic as early as possible with the date, location, and list of the students attending so it can be reviewed for medications and needs. Nurses may not be available to complete the necessary student-specific trainings with a teacher on a very short notice. Immediately prior to your field trip, you will need to sign out the medications from the clinic. Staff member who will be administering the medications on the field trip schedules a time to meet with the clinic assistant to prepare medication, either the day before or the morning of the field trip. The staff member is responsible for all medications they sign out. Here is an example of the form that you and the clinic assistant will complete when signing the medications out of and back into the clinic. If pills in the bottle are being checked out, the entire bottle needs to go because the label will need to be checked upon administration of the medication. This means a pill count will need to be completed upon checkout to the teacher and again upon return back to the clinic. Here is a short video reviewing all of the steps on the competency skills checklist for administering an oral medication. Step 1. Medication given in a safe, controlled environment. Step 2. Medication removed from this locked location. If on a field trip, this may be your backpack and Ziploc bag containing the student's medication and paperwork. Step 3. Wash your hands. If you're on a field trip or unable to wash with soap and water, hand sanitizer with at least 60% alcohol may be used. Step 4. Have the student identify him or herself. Step 5. Check the student's identity with the name on the medication container label. Step 6. Verify medication order by comparing the authorization form with the labeled medication container. Step 7. Medication is correctly administered to student remembering the 5 rights. Be smart. Identify the right student, verify the medication name, verify the amount or dose of medication to be given, verify the correct route, and identify the correct time to administer the medication. Step 8. Be sure the medication does not come in contact with your hands during administration or when removing it from the container. The amount ordered may be given to the student directly to take orally. Step 9. Check that the student swallows the medication. Step 10. Check the label again. Step 11. Administration of the medication is recorded on the individual student's medication record per guidelines in medication administration policy. This may be done in Skyward electronically or on the field trip medication administration form. Step 12 is the medication is then returned to its locked location. Once you have administered the medication according to the policy and procedure, like we just went over, you will need to document appropriately and completely. Here is a section of the form that you will have on the field trip to document on. Be sure to complete all appropriate sections accurately and completely, as this is the medication administration record that will be filed in the student's health file. Once you return to school, you will need to immediately return the medication container to the clinic assistant. Remember, it is not okay to leave medications in the clinic mailbox. You and the clinic personnel must log the medication back in. He or she will count and record each medication on the field trip medication log, and both will sign. The clinic assistant will then review your documentation with you to be certain they have been properly recorded. There are some special situations that may not be typical. There are times when it is important that the school board nurse is notified, like when a student has a reaction after taking a medication, a student refuses to take a medication, or a medication error is made. All of these situations would also require the completion of a medication incident report. Other special situations would be when a student's medication needs to be stored in the classroom instead of the clinic. Be sure the school board nurse is aware, it remains in a locked cabinet, and the teacher will also need to follow all parent sign in and sign out procedures, like one would in the clinic setting. Evacuations and codes are another special situation. We want to be sure students that self-carry any medications or health condition related supplies should have everything with them at all times in the event of an emergency. Now we are going to review 4 of the common medical emergencies that could occur and the related emergency medications. What is asthma? Asthma is a chronic lung disease that causes the airways to fill with mucus, airway linings to swell, and muscles around the airways to tighten, all making it difficult to breathe. The typical signs and symptoms might include lack of energy, irritability, stuffy or runny nose, retractions, nasal flaring, shortness of breath, wheezing, coughing, chest tightness, and appearing fearful or worried. The emergency medication for an asthma episode is a rescue inhaler. The rescue inhaler is typically albuterol or levobuterol and works quickly to open the restricted airway. A student may also have an inhaler at home that they use daily, but this is different than the rescue inhaler. Pictured here are the rescue inhalers that you may see for students. Here is a short video reviewing all the steps on the competency skills checklist for administering an inhaler. Step 1. Able to state symptoms to indicate need for the inhaler use. Step 2. Check for authorization. Compare the authorization form to the medication label. Step 3. Check for the 5 rights. When comparing the medication authorization to the medication label, make sure you remember Be SMART. Identify the right student, verify the correct medication, verify the amount of medication, verify the correct route, and identify the correct time to administer the medication. Step 4. Wash hands. Both you and the student should wash their hands with soap and water. Step 5 is have the student sit or stand upright before administration of the inhaler. Step 6. Demonstrate or state proper technique for using the inhaler. Prime the inhaler if it's the first use or has not been used in 14 days. To prime, shake and spray 2 to 3 pumps into the air away from the face. To administer, shake the inhaler immediately prior to use. Coordinate the inhalation with the administering dose, or have the student slowly breathe in from the spacer or aero chamber with the pump. Have the student hold their breath for 10 seconds, or with the spacer, breathe in and out the ordered number of times. It's also good practice to have the student rinse his or her mouth with water after each inhalation. And be sure to wait 1 full minute between puffs. Step 7. Document the event and the medication administration immediately. Anaphylaxis is a severe allergic reaction that can be life-threatening. Common triggers could range from foods like peanuts and eggs to environmental things like bees and fire ants. When dealing with possible allergic reactions, we want you to think fast to remember the signs and symptoms. F is for face, any itching, redness, swelling of the face or tongue. A is for airway. Think of trouble breathing, swallowing, or talking. S is for stomach, any abdominal pain, vomiting, or diarrhea. And T is for total body. Think of your skin, anywhere besides the face with a rash, redness, swelling, or if there's paleness or loss of consciousness. Anaphylaxis must be treated immediately. The drug of choice is epinephrine, or sometimes called epi. Emergency medical services or 911, and parent or guardian will also need to be called. Epinephrine is administered through an autoinjector into the large muscle of the outer thigh. Shown here are the types of epi autoinjectors you might see for your students. They are all a little bit different, but they all deliver the drug epinephrine. You may want to familiarize yourself with the specific type that your students have in your classrooms to be as comfortable as possible with using it if necessary. Remember that the administration instructions are always on the autoinjector itself in case you need reminders. Here is a short video reviewing all the steps on the competency skills checklist for administering an epinephrine autoinjector. Step 1. Identify symptoms of a severe allergic reaction. This may be indicated specific to the student on the emergency action plan or the medication authorization form. Step 2. Instruct another school staff member to call 911. Be direct, make eye contact, and speak loud and clear. You may even point to the staff member to be sure they know what to do. You, go call 911. Step 3. Check for authorization. Compare the authorization form to the medication label. Step 4. Check for the 5 rights and be smart. Identify the right student, the right medication, the right amount or dose, the right route, and the right time to give the medication. Steps 5 and 6 are apply gloves and demonstrate proper administration of the epinephrine autoinjector. First, remove the autoinjector from its container. And remember, blue to the sky, orange to the thigh. Then remove the blue safety cap from the pen. Next, firmly press the tip against the student's outer thigh until you hear and feel a click, and hold for 3 seconds, 2 seconds for AviQ or 10 seconds for generic. Then massage and rub the area for 10 seconds. Step 7. If you are alone with the student, call 911. Step 8. Remain with the student until EMS arrives. Step 9. You may dispose of the autoinjector by giving it to EMS, or you can place it in the sharps container. Step 10. When the student is stabilized or has been transported to the hospital, you can remove your gloves and wash your hands. And step 11 is to document the event and the administration of the medication immediately. Remember that an allergic reaction requiring the use of epi is always a 911 call. Next, we'll review seizures and epilepsy. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in your behavior, movements or feelings, and in levels of consciousness. If you have 2 or more seizures or a tendency to have recurrent seizures, it's termed epilepsy. There are many different types of seizures which range in severity. Among the different types of seizures, a type that requires an emergency response is typically the convulsive, tonic-clonic, or grand mal type. With this type of seizure, you may see the person experience loss of consciousness, stiff muscles, rhythmic muscle contractions or muscle quivers, blue skin from poor circulation, drooling, rolling of the eyes, incontinence, or biting the lip and or tongue. These can certainly be scary to experience, but try not to panic. Seizure first aid may need to be a group effort. We want to help the student on his or her side on the ground while protecting their head. It is important to note the time and monitor the length of seizure. Someone needs to call for help. Be sure whoever calls shares the name of the student and the location of the event clearly. Other students should be escorted out of the room or area. And try to note the description of the seizure, what you see, so you can share with the clinic staff, parent, or emergency medical services. Diastat is an anti-seizure medication commonly used for emergency situations for prolonged seizure activity. It is a gel form of diazepam, or better known as Valium, that is administered rectally. Clonazepam, or Klonopin, is another medication that is sometimes used to prevent and control seizures. It is usually in tablet form and is placed in the pocket of the person's cheek to dissolve and work quickly to calm the brain and nerves. The period of time to administer either of these medications is determined by the student's physician. For some, it's 5 minutes, and others it's less, and some more. Because the doctor writes specific orders as to when the medication is to be given, we need to know when the seizure activity starts. This makes your role very important in the classroom. As soon as seizure activity starts, the time needs to be noted and tracked so it can be determined if and when the medication can be given. Administering anti-seizure medications requires one-on-one training with your school board nurse. For now, we need you to be aware of your specific student's seizure type, triggers, and signs and symptoms. Be prepared to provide seizure first aid. Be prepared to note the time seizure activity starts, to measure length of seizure for medication purposes, and to be prepared to call for help and have other students in the classroom removed. Some epileptic students may have an implanted device called a vagus nerve stimulation, or VNS. In certain situations, the student's handheld or wrist-worn magnet can be used to activate this implanted stimulator to stop or even prevent a seizure. Implementing this procedure requires one-on-one training with your school board nurse. Seizure activity is generally a 911 call, but this may differ student to student. So please familiarize yourself with each of your students' emergency action plan or speak with your clinic or school board nurse. Let's move on to our final medical condition that you might see in schools: diabetes. There are two common types of diabetes that you may see. Type 1 is when the body can no longer produce insulin and the patient must take insulin to survive. Type 2 is when the body does not respond to or use insulin properly. Their treatments can vary, but may also include taking insulin. Insulin is a hormone normally made by the body. It helps glucose or sugar enter cells where it can be used for energy. Without insulin, glucose remains in the bloodstream and cannot be used for energy by the cells. When the glucose is in the bloodstream, it can be detected and measured, which is how diabetics monitor their levels. The important thing to remember is that high blood glucose levels, or hyperglycemia, can be dangerous if sustained. They can be treated with insulin or other actions. But low blood glucose, or hypoglycemia, can be deadly. Low blood sugar requires immediate action. Hypoglycemia poses the most immediate risk to a student with diabetes because onset can be sudden. It is not always preventable, and it may progress to unconsciousness and convulsions if left untreated. Please contact your clinic assistant immediately for symptomatic low blood sugars. And never send a student with a low blood sugar to the clinic. The clinic personnel should come to the student. If the blood sugar level is so low that the student cannot take anything by mouth to bring the level up, is unconscious, or is having a seizure, the emergency medication glucagon will need to be administered. There are three types of glucagon available: an injectable that requires mixing, a ready to use injectable, and a powdered nasal spray. All require further training with your school board nurse to administer. Administering glucagon of any form is always a 911 call. This is a complex condition with varying signs and symptoms and treatments. Be sure to familiarize yourself with your students' specifics. All right, moving on to our last couple of topics. If parental consent is on file, the student can receive first aid services in the clinic setting. This means that teachers can no longer provide non-emergent care, such as Band-Aids, ice packs, or additional services in the classroom for minor injuries, illnesses, or complaints. All students must be sent to the clinic if in need of first aid care, so consent can be verified. For vague complaints, teachers can allow the students to rest their head, drink water, or use the restroom before sending them to the clinic, as these are not considered first aid interventions. Please keep in mind that school staff still reserves the right to call 911 and provide any emergency care in the event of a serious accident, injury, or illness, regardless of the parental consent status. This is a quick reference sheet you can print for your classroom. This will be made available to you electronically or through your school's clinic. Keep a copy in your classroom's health folder along with these student emergency action plans for you or a substitute. AEDs, or automated external defibrillators, are used in emergencies when a person is unresponsive and not breathing. You should know how many and where they are located on your school's campus. And you should know who is trained to use the AED and how to contact them during an emergency. Please notify your clinic assistant if you are certified or trained to use an AED by providing a copy of your CPR AED card. Lastly, we'll review student health information. Most student health information can be found in Skyward. If a parent has informed the school of a medical condition but may not require any medications or actions, it would be considered a Level 1. Level 2 would be a medical condition that would require you, the teacher or staff, to know more specifics about this student and their condition. The school board nurse will create and make available an Emergency Action Plan, or EAP, for you to review and follow in case of a related medical situation. A level 3 would be a more complex medical condition that the school board nurse would determine the need for an individual health plan. This IHP would also include a related emergency action plan for you to review and refer to. So, how do you know if a student has a health condition, EAP, or IHP within Skyward? Most of the information you'll need can be found in the alert box within Emergency Info, which can be found multiple ways: either the green note icon, the red bubble icon, or on the student's profile page. Health conditions, allergens, and medication information may be available here. If the student has an emergency action plan, the digital copy can be found within Teacher Access, My Students, Student Info, and then under the section IHP. A paper copy should be provided to you by the school board nurse or clinic. Be sure to have this available for your substitute. There will also be a copy in the student's med folder in the clinic and attached to their emergency card. If a student has an individual health plan or IHP, it will also be located digitally in the IHP section with the associated EAP. Phew, that was a lot of information, but we thank you for your time and especially for your commitment to all our students. To receive credit for this training, you must complete the knowledge check evaluation. You will also need to electronically complete the 3 competencies reviewed. You can also access this training to review it again at your own pace on Safe Schools. More condition and medication specific courses are always available on Safe Schools to view for more detailed information. Please contact your school board nurse anytime for any additional training, questions, or concerns you may have now or throughout the year.